Have you heard? For the first time ever, there's an injectable treatment for moderate to severe fat below the chin. The best part? It can be administered by your doctor right here in our office. The injection procedure takes 15 to 20 minutes and it doesn't require any surgery. Kybella deoxycholic acid injection is a first-of-its-kind injectable treatment that reduces fat under the chin or submental fullness for a contoured profile. No surgery required. Submental fullness can impact a broad range of adults, including both men and women. So, what causes submental fullness? Submental fullness can be caused by a variety of factors. Sometimes, even with diet or exercise, submental fullness may not go away. According to a 2015 survey conducted by the American Society for Dermatologic Surgery, 67% of people said they're bothered by submental fullness. If you're one of the many people bothered by submental fullness, ask your doctor if Kybella is right for you. Kybella is a series of injectable treatments tailored by you and your doctor to gradually improve your chin profile. Up to 6 sessions spaced at least 1 month apart may be needed. So, how does Kybella work? Kybella is a non-human and non-animal formulation of deoxycholic acid, a naturally occurring molecule in the body that aids in the breakdown and absorption of dietary fat. When injected under your chin, Kybella destroys fat cells. And once those cells are destroyed, they can no longer store or accumulate fat. The results of Kybella speak for themselves. In clinical studies, 79% of people treated with Kybella had improved satisfaction with the appearance of the area beneath their chin, compared with 34% of people treated with placebo, 12 weeks after last treatment. Kybella patients reported improvement in the visual and emotional impact of submental fat when asked how happy, bothered, self-conscious, embarrassed, old, and overweight they felt with respect to the amount of their submental fat after they received treatment. According to one Kybella patient,
I consider myself a pretty confident person, but one of my main insecurities had always been my double chin.
Another Kybella patient tells us, I've always been at a healthy weight. I tried exercising, but it didn't matter what I did. I still had a double chin. With Kybella, I don't feel like I'm trying to hide something anymore. If you're bothered by fullness under the chin, whether it's moderate or severe, you don't want to get surgery, you feel your double chin makes you look older or heavier than you actually are, or you eat well and exercise, but submental fullness does not go away, Kybella may be right for you. Only your doctor can determine if you're a candidate for Kybella. You should not receive Kybella if you have an infection in the treatment area or have had or have trouble swallowing. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, and trouble swallowing. The most common side effects of Kybella occur in the treatment area and include swelling, bruising, pain, numbness, redness, and areas of hardness. Interested? Talk to your doctor about Kybella today. Important safety information about Kybella. Kybella is a prescription medicine used in adults to improve the appearance and profile of moderate to severe fat below the chin, submental fat, also called double chin. It is not known if Kybella is safe and effective for use outside of the submental area or in patients under the age of 18. You should not receive Kybella if you have an infection in the treatment area. Before receiving Kybella, tell your healthcare provider about all of your medical conditions, including if you have had or plan to have surgery on your face, neck, or chin, have had cosmetic treatments on your face, neck, or chin, have had or have medical conditions in or near the neck area, have had or have trouble swallowing, have bleeding problems, are pregnant or plan to become pregnant, it is not known if Kybella will harm your unborn baby, are breastfeeding or plan to breastfeed, it is not known if Kybella passes into your breast milk, talk to your healthcare provider about the best way to feed your baby if you receive Kybella. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you take a medicine that prevents the clotting of your blood, antiplatelet or anticoagulant medicine. Kybella can cause serious side effects, including nerve injury in the jaw, which can cause an uneven smile or facial muscle weakness, and trouble swallowing. The most common side effects of Kybella include swelling, bruising, pain, numbness, redness, and areas of hardness in the treatment area. These are not all of the possible side effects of Kybella. Talk to your healthcare provider for medical advice about side effects. For more information, please talk to your healthcare provider or see full prescribing information in our brochure or on our website at www.mykybella.com.